class. Top 10%, top 3%, top person in class because no one's failed anything yet, we hope. Okay. If you fail something in orientation, maybe you guys should come see me right away, to do that. I apologize for not being here on the opening day, but it was a very important event for the college and the profession. We were opening the building that we built in Africa and the MRI that General Electric donated to the Queen Elizabeth Hospital in Malawi, which is a very large hospital. It's a 1,200 bed hospital with 1,800 patients at any one time. So most of the hospital administrators in the crowd would like that kind of occupancy, but they actually put 3 babies in each crib, and they use the floors with mattresses to do it. It's a different kind of health care, but the machine and the research that the profession does in Malawi for cerebral malaria in children will really set the standard. I bring that up for the students that are beginning this adventure in medicine because going there really renewed my belief in what we do in medicine. You get wrapped up in the U.S. about the cost of healthcare and the waiting time and the billing process and the insurance companies, and then you go there and you see a young mother with a child who's very sick that will sit patiently on a bench for 7 hours and wait for a shot because that's all they can get, and to do that, and it gives you a renewed sense of when you come back and somebody's in the clinic and they're mad because they waited 20 minutes for something, it gives you a different perspective on the issue. And since you're just starting out, you should maintain your image of what medicine should be, because right now it's different than it will be 4 years from now, and certainly different than it will be in 7 years from now, because we get 7 years to beat all these idealistic notions out of you before we turn you loose on the general public. Anyway, for the audience and everything else, all the parents, grandparents, and everybody, welcome to Michigan State University and the College of Osteopathic Medicine's 38th annual convocation. And we're honoring the class of 2012 today and our osteopathic medical scholars. And this is always a happy time and a great event for us to do. One little detail administratively, for all of us that live by an electronic umbilical cord, I'll have you please turn off your vibrators, your phones, your pagers, or at least put them on stun so nobody can hear them. Okay, to do that. Okay. Stun is a Star Trek generation. It's my privilege today to introduce the current president of the Michigan Osteopathic Association, who is also a clinical professor of medicine with the college. And Dr. Craig Mignata is also an alumni of the college. Dr. Mignata received his Bachelor of Science degree from the University of Michigan. For those of you who don't know, that's a small trade school down the road. My apologies to Jennifer, his wife. She had this going on. He completed postgraduate studies at Wayne State University, and then he received the light and received his Doctor of Osteopathic Medicine degree from Michigan State University, College of Osteopathic Medicine in 1978. Dr. Mignata is board certified in family practitioner and private practice in Meadowbrook Family Med Centers in Troy and Oxford. He's a member of the Department of Family Practice with both North Oakland Medical Center and the William Beaumont Hospital, and is a past president of the Michigan Association of Osteopathic Family Physicians. Dr. Mignata, as I said, serves as a clinical assistant professor in the Department of Family and Community Medicine at this college and has done so since 1996. Please join me in welcoming our MOA president, Dr. Craig Mignata, DO.
Been almost exactly 30 years since I started medical school here, or graduated from medical school here, I'm sorry. We started in 1975, and at that time, it was a 3-year program year-round, so we were called the 3-year wonders. I'm here today to congratulate you, the class of 2012, on your acceptance into the Osteopathic Medical School and surviving your first week of anatomy. I'd like to provide you with some information that will help you survive the rest of your career. But first, I'd like to administer your first exam. What do all these things have in common? Medicare and Medicaid reimbursement, individual market healthcare reform, practice transformation in the patient-centered medical home, chiropractic scope of practice, state rural health plan, physician quality reporting initiative, the economic impact of healthcare in Michigan, the chronic disease registry, electronic prescribing, and graduate medical education funding. There are two answers. First, today's discussions about these topics will affect how you practice medicine after you graduate. Second, you can influence the outcome of these discussions by becoming activists and getting involved with your statewide Osteopathic Association. The Michigan Osteopathic Association, representing more than 7,000 osteopathic physicians and students in Michigan, can help guide you through this maze of healthcare terminology and concepts, and even provide you with opportunities to help shape the practice environment you envision for yourself and your patients in the future. As an organization, the MOA gains momentum with each individual physician and osteopathic supporter who becomes an activist for positive solutions. As president of the MOA, I am proud to inform all 211 of you new MSUCOM students that you are also new members of the Michigan Osteopathic Association. In a moment, class of 2011 MOA student representatives will present you each with a symbolic MOA membership pin. But I encourage you to further solidify your membership by taking advantage of the resources and the opportunities now available to you. Read the MOA publications and check out the website, the programs and presentations that the MOA Student Liaison Committee designed specifically for you. Attend the Capitol House call in March to discuss healthcare issues with your legislators, or apply to participate on one of the MOA committees. Today you will don your white coat and become officially acknowledged as Osteopathic Medical School students. You've survived your first 5 days. Membership in the Michigan Osteopathic Association can help you survive the rest of your career. Welcome to the DO family. We're proud to have you among us, and thank you for your attention today.